At this point, I've probably consulted with thousands of knee pain patients, and obviously we take a detailed history. We learn a lot about what their life looked like leading up to that, to the point where they started to develop chronic and consistent pain. In many cases, a lot of the patients with really severe arthritis have taken part in arthroscopic knee surgery, specifically for like meniscus tears. And it's funny because, the literature is really very clear. Back in 2014, New England Journal of Medicine said if you have to undergo a surgery like that, then the risk of developing or having a knee replacement, you'll have it 1/3 sooner. So your risk goes up by like 400%. The British Medical Journal, they did a 15,000 study meta-analysis. And at the end of that study, their conclusion was like the small inconsequential benefits don't outweigh the risks. What that means is it probably doesn't really make a whole lot of sense to do those surgeries, especially in middle-aged individuals with any sign of arthritis, even if it's mild. Now, there's a time and a place where meniscus are injured to a degree that they have to be surgically repaired. Not necessarily even just repaired, or there has to be some removal of some tissue. And that is something that, I believe wholeheartedly in, because there is no other solution to maintain their function and get them back to a certain level of symptomatic relief. The problem is, once we remove tissue or once we alter the dense structural tissues in our joints, then what that does is that sort of sets us up for more degeneration down the road. So, from my perspective, if we do have to undergo a procedure like that, we have to first make sure that it's absolutely necessary to get us back to functioning, right? And in many cases, it's not. But if it's absolutely necessary, then it would be beneficial to follow that up with some type of regenerative approach so that we can heal and we can maintain structural integrity of the tissues, and we can possibly prevent arthritic process from developing. If anything in this video resonates with you or you have any questions, please feel free to reach out to our office so that we can help.